Hello there, welcome to this presentation. My name's Darin Browne. Most of you have met me if you're our patients. I run a firm called ICU Optometrist, and we're behavioural optometrists. We specialise in working with kids with learning problems, etc., etc. And that's why many of you are here, because you've heard about something I've got that can help you conquer dyslexia and learning problems in your child and release their full learning potential and escape the homework nightmare. Now, this little statement sort of encapsulates it all. You know, you see your child struggling with some sort of a learning problem. You don't know if it's dyslexia or not. You realise they're not working to their full potential, and homework is a nightmare. So if that sounds a bit like you, I've said in 3 steps, but they're pretty big steps, some of them. I put this webinar together for you. So this is an online seminar just dealing with how you can approach this problem and conquer it, because we want the very best for you and for your child. Now, if you've been to ICU, then you're probably asking the question, well, aren't the glasses enough? Because I may or may not have given your child glasses, but chances are I have. And you say, well, hang on, they've got glasses. Now they can see better. Surely this is enough. But it's not enough. First of all, the glasses usually don't help kids see better. It helps them concentrate more. So reading or enhanced reading glasses, like you've probably got, are designed to help children to concentrate for longer without feeling visual stress. So they should be able to look at their close work for a longer period of time without actually undergoing stress. So by visual stress, we would mean either a stress reaction like sore eyes, headaches, tiredness, extreme tiredness, particularly late in the day, or alternatively, losing concentration and not even trying, or bailing out very quickly, or daydreaming, or something along those lines. We'll go through the symptoms later on. But the glasses are designed to relieve a lot of those symptoms. The glasses do not catch kids up. So if you have a child who's 2 years behind in their reading and you get these special glasses, they should concentrate more, but they won't. You don't wave a magic wand and suddenly they're caught up. There's some hard work ahead. You know, clearly, if you put glasses on someone, it might help them concentrate or see a little better or whatever, but it's not going to catch up years of being behind. Many parents actually come to me and they beg me, say, please help my child become average. I just want them to reach the middle of the class. I just want them to be, quote unquote, normal. Well, I've actually stopped thinking along those lines, because so many of our kids, when they do this therapy program, they punch right through the average, right to the top of the class, because many of the kids that we work with, and I'm sure if you look at your child, you probably suspect this, are a lot brighter than anyone thinks. In fact, some of these kids are really, really smart. The problem is they're not able to reproduce that smartness, if you like, when it comes to learning and so on in the classroom. So my aim is to help your child reach their full potential in life, not just academically, but in life. If you've got a child who's running 2 or 3 years behind in reading and say they're in grade 3 or 4, well, you've got a few years to get it right before they go to high school, because when they go to high school, they stop learning to read and they start reading to learn, and it's a completely different process. So you need to make sure they're reading really well now. If they're reading well now, that's the gateway for knowledge to flow into their head so that they can learn quickly and effectively and reach their full potential in life. If they're struggling now and you let it go 6 months, a year, 2 years, they're going to be 2 years further behind. You're going to have more of a job trying to catch them up. And in fact, many parents have almost given up on the possibility of, of catching their child up. And we don't even want to just catch them up. We want to accelerate them right to the top. So my aim as a behavioural optometrist is to help your child reach their full potential in life. So this webinar is for you as a parent. If you have a child who's been diagnosed with dyslexia, learning disabilities or learning difficulties, Asperger's, ASD, or even ADHD or ADD or any other DDs around, all of these things, I mean, I'm not saying they're misdiagnosed, but sometimes the water's pretty cloudy, and if you can find an alternative to some of the treatments that are out there for some of these conditions, you will be well served, because some of the treatment is really tough stuff, drugs and that sort of stuff. Some of it's really hard. It's also for you if you have a child who struggles to concentrate on their schoolwork or is easily distracted. Now, as I said, the reading glasses may help, But if you've got a child who's struggling to concentrate and is easily distracted, chances are you need what I'm going to talk about in this webinar. Also for you, if you have nightly homework battles with your child, which often end in screaming or tears. Now, I'm not in your home, but for many of the kids that we deal with, homework looks a bit like this. Johnny, sit down and do your homework. What are you doing now? I'm getting a drink. Now get back here and do your work. What are you doing now? I'm going to the toilet. Now get back here and do your work. What are you doing now? I'm sharpening my pencil. Now get back here and do your work. And everybody gets louder and louder, and they finish up in conflict trying to get them, because it's so frustrating for you as a parent, and it's very frustrating for them as a child as well. So if you go through that with your child every night, this webinar is for you. It's also for you if you believe your child is capable of producing better work in school. If you look at what your child is doing in school and say, well, hang on, my child's smarter than this. My child should be doing better than this. Then you're the sort of person this webinar is for. Also, if you've been suddenly surprised by a teacher reporting that your child is underperforming or needs remedial help. This happens more often than you would imagine, actually. I have many parents that come to me, their child's in, say, grade 3 or 4, and the teacher comes and says, your child is so far behind, we're going to have to put them in remedial reading help or support a reader. And you say, well, why didn't you tell me this when we were back in grade 1? But it seems to slip through the cracks. And we don't want any more slipping through the cracks. We want to solve the problems. It's also for you if you've spent good money on any other treatments or tutoring with little or no improvement in the child's performance and results. Now, this happens very frequently as well. You go out, you do what the experts say, you spend a ton of money paying experts to do it. It could have been coloured lenses, it could have been clinical psychologists, or it could have been paediatricians, it could have been tutoring. You spend a lot of money with these people, but if you haven't seen tangible results, chances are there's a blockage in there. And if there is a blockage, it is very, very likely that the blockage is in the visual area, which I will go to in this webinar, and you'll understand a little bit more as we go along. First of all, a little bit about me and what led me to work with children with learning problems. As I said, my name is Darin Browne. I'm a behavioural optometrist on the Sunshine Coast of Queensland. If you haven't met me, good luck to you if you haven't. I graduated from optometry school in 1984, but I was very soon dissatisfied with the whole mode of practice. If you know anything about optics, it's about people screaming at one another, and we can do cheaper glasses. And so the whole pressure on optometrists is to push patients through fast and churn out pretty basic sorts of glasses. Was very dissatisfied with that. I thought, gosh, there's got to be more to life than this. So I attended a behavioural optometry seminar in 1985, which changed my life. In fact, it so radically impacted me, I went back to my practice and immediately implemented some of these modes of treatment on myself and got stunning results, like for myself. So that's how I know it works, because I've actually done a lot of this stuff with myself. I then studied and completed a postgraduate fellowship of the Australian College of Behavioural Optometry in 1989. One of the first people to go through that course. I'm a lot less excited about the courses now. In 1990, I adapted vision therapy programs from other optometrists with little or no success and impact. And this used to drive me mad, because other optometrists would come and say, oh, here's our program, or here's a bunch of exercises. They were all over the place. They didn't make a lot of sense. There were bits and pieces, and there was papers flying everywhere, and it just did not seem to work, and no one was doing them. So I thought, well, that's a bit of a waste. I knew that therapy could help, but I couldn't figure out how to do it properly. Here was the big thing. In 1994, we discovered that my oldest daughter had a learning disability. She is, in fact, Asperger's. Now, she still is today, but we've had phenomenal success with her. Very briefly, she was going through school. I didn't know enough to help her at the time. I didn't know how to implement these therapies. I was sort of fiddling around trying to sort it out, but my daughter was failing miserably at school, one of my daughters. And she actually left in grade 11, and we took her out of school. We said, what do you want to do with your life? And she said, I want to work with kids. That's all I want to do. I want to be a teacher. I want to work with kids. We'd been told she'd never be a teacher. So we sent her to nanny school, and then she started to nanny. But her world sort of caved in around her, and she just never went out of the house. She never went to youth or never went out with kids or anything like that. She just was absorbed by her host family, if you like. So it was very unhealthy for her socially. So what I did, I have a friend who runs a school for refugees up in Malaysia, and I took her up there and I said, would you take my daughter to be an assistant in your classroom? He said yes, he would. And she started up there. Now, here's the cool thing. To become or to stay in the country, she went in and out a few times on a 3-month tourist visa, which is not enough. You're forever going in and out of the country renewing your visa. So they said to her, in order to stay in the country, you have to study. So she said, well, I don't want to study, and had a few tears. We enrolled her in a course up there at a university so she could get a student visa. And then 3 years later, she graduated as a fully fledged primary school teacher in Malaysia. So we're very, very proud of Tara. She's an excellent young lady who's conquered enormous difficulties. And that's part of the reason I realized I needed to help kids like her reach their full potential. Today, she is a phenomenal young lady. She's married to a Malaysian boy, and they're working together in the same school up there. It's a wonderful story, and we're very proud of her. And that sort of drives me on. I found that traditional therapies seemed powerless to help her, and so I started studying the Vision Therapy Masters. I started going back and looking at guys who were working in the 1920s and 30s, because we've got so high tech in the optical world, we've forgotten some of the basics that really worked back in the day when they were low tech. So I went back and sort of gleaned through a lot of their stuff and really learned a lot of really good stuff that I've put into my therapies. So you might be wondering, is there a scientific basis for vision therapy? There is now tons of evidence in scientific literature supporting the role of vision and visual skills in learning, and how the right type of vision therapy can dramatically improve learning and reading performance. Why I say the right type, not all therapy, not all vision therapy is equal. And you want to be targeting the ones that are going to change the way your child learns, not just change my optometry measurements. But there certainly is a very strong scientific and neuroscientific basis for that now. As I said, I didn't like the traditional vision therapy exercises, so I decided to design my own, to target school and learning improvement, not just my optometry measurements. As I said, I didn't want to just see my measurements change, although they do. I wanted to see kids improve their learning. So the question is not whether vision therapy works, it's what type of vision therapy works best. My quest, I wanted to find help for the parents of children with dyslexia or learning problems. For parents who feel powerless to help their children, and many parents come to me, they say, what do I do? I have teachers who are parents who come to me begging me, what can I do to help my child? They're so frustrated because there's no help around. For parents who are sick of watching their children struggle to learn, if you've sat and watched your child try and learn and been just frustrated and just hurting for them that they don't get it. You go over things again and again and they don't get it. That's who I wanted to find help for. For parents who are tired of seeing their child's self-esteem shattered by schoolwork. Kids who say, oh, I'm dumb. And there's a lot more of this going on than you would realise. And it may not be the other kids saying they're dumb. Oftentimes it's they themselves. They're not. Honestly, kids are pretty astute. They know if the other kids are getting it in the class and they're not getting it, that something's wrong. So many of them, their self-esteem is just completely ruined by this. And if you don't clear it up, it'll be ruined practically for life. I wanted to find help for parents who are done with fighting over homework every night. If you're over fighting with homework, you need to have a look at this therapy. And also for parents who genuinely believe that their child is smarter than their school results and want to do something about it. Now, everyone thinks their kid is smart and gifted and all that sort of stuff. I understand that. But if you've got a bright child who's doing poorly in school, prime candidate for vision therapy. Absolutely prime. Because they're the kids we get the best results with, because it's not about their brain. It's about getting the pathway for information in through the eyes correct. So here's a little something to think about from that website and the American Optometric Association. 80% of children who are reading disabled, including dyslexics, have vision problems which can be solved. which can be solved. Folks, 80% of kids with learning problems are out there with something we can help, but they don't seek help in the right place. 25% of all children have a significant problem, have a problem significant enough to affect their performance in school. So 1/4 of all kids have a vision problem that's going to lower their performance in school. 95% of first grade non-readers have significant visual problems. So if you have a child who's in grade 1 or 2 and they're not getting it, they're not reading very well, 95% chance that we can help them. 95%. These kids have nearly 2.5 times more visual problems than high achievers. And in one California-funded study, repeat offenders reduced from 45% to 16% when they received on-site optometric vision therapy, which is what I'm talking about here, vision therapy. So, that is 1/3. They dropped to 1/3. Isn't that incredible? When they got vision therapy, their behaviour improved out of sight. So, pretty significant. And obviously that's due to kids being frustrated and lashing out. School screenings detect only 20 to 30% of significant visual problems. I think that's generous. They miss a lot. 1 out of 10 children is at risk for having an undiagnosed visual problem. I think that too is generous because I think it's way higher than 1 in 10. So there's just some figures from the American Optometric Association to think about. Now that's not the behavioural optometry, people. That's just the general optometry in the United States. Here's a testimony from one of our mums. The program has significantly improved our son's reading, writing and vocabulary. Now, you can read there what she said. We work with all sorts of kids, but we do get a lot of kids where things just click and ka-ching, away they go. It's phenomenal. I actually had a mum just the other week say to me, we struggle with the therapy. We haven't done it recently. We only got up to level 7. And I said, well, how's he been going? She said, well, he's up 26 levels in reading. And I went, okay, cool. Well, obviously something's clicking, and that can definitely happen. And that's our aim. Doesn't always happen. Sometimes it's a hard slog, but sometimes you can really open the door for your kid. In this webinar, I want to show you the little-known visual skills that can have an enormous impact on your learning or on a child's learning, the symptoms to look for to discover if your child has visual problems, and many of you have got these figured out anyway, and simple tests that you can do for yourselves at home to see the effects of vision problems on your child's learning. Now, most of you have been into my office and we've had an eye test, so you don't need to do these tests, but they'll be interesting for you. I can also show you how you can spend just 20 minutes a day doing the right vision therapy in the right order with your child to see an improvement in their performance within 3 months. And I'm not exaggerating. I'll also show you how you can do this in your own home without therapists, optometrists, or tutors. Now, God bless the tutors. They work really hard, but they're fighting the same thing you are, the lack of visual skills. So we can help them out as well. Also, I will show you how we structure our vision therapy and we keep you on track and give you some free ideas for therapies you can do with your child right now. So, what are visual skills and how do they affect dyslexia and learning problems? Visual skills are skills that involve both vision and understanding of visual information, which we will learn to master as we practice and develop. So it's not about getting a child to see the print, because they see the print. That's not the issue. It's getting them to interpret, understand, recognize, flow from word to word, all of those extra things. It's not just getting them to see it. Getting them to see it comfortably and understanding the information. We all use visual skills, but they're usually developed naturally as we learn to read, write, and spell. So as a child grows from prep into grade 1, into grade 2, and so on, they learn skill upon skill upon skill just as a natural consequence of that, or at least a good reader and a good learner does. Most teachers, particularly in the later grades, skip the teaching of these skills. They go straight to teaching kids how to read, leaving many kids behind. Now, if the child has learned or picked things up well and learned correctly, it's not a difficult thing to jump to straight into reading. But if there's bits missing, if there's skills missing, if there's skills they haven't got, then it's completely different and it's much harder. And that's why many kids are left behind. Visual skills are tools with which the child learns. So if you haven't got these skills, you haven't got the tools to do the job. It's that simple. It's like trying to play cricket without a cricket bat. You haven't got the right tool for the job. So how could you build a table without the right tools? If I came to you, I said, here's a pile of wood, build me a table. You say, okay, well, give me a saw, give me a hammer, give me a screwdriver, screws, give me a measuring tape. No, you don't get those. You just get the wood. How would you be making a table? Pretty ordinary, I'd imagine. I wouldn't want to be sitting to your table. And it's the same with reading. We just come in and we say, read, but we don't give the kids the tools they need to do the job. So, what are visual skills? They're skills like any other skills. We pick them up, and you can train them as well. That's the thing. You can either pick them up naturally or you can train them. In other spheres, like playing football or soccer, learning the guitar or the piano, learning tennis, anything like that, we go and we train. So you go to football practice to become a better footballer. Are you playing the game? No. You're learning the skills. You go to guitar practice to be a better guitarist. Are you playing on stage in front of thousands of people? No. You're learning the skills that when you do get on stage, you can draw on those. But the problem with reading is we just throw the kids on stage and say, go. We just throw them on the field and say, play. We don't give them the skills and the tools they need to do the job. It is more powerful to train these skills separate to learning to read, because this will supercharge their reading, writing, and spelling. If you wanted to learn the guitar, you could kind of pick it up when you're on stage playing with the band. You'll pick up bits and pieces you'll learn, but it's far more powerful for you to come apart from the other guys, sit down with a guitar teacher and learn it properly. Same with football. You can go onto a football field or a soccer field and you can run around chasing the ball and trying to get it, and you'll pick a few skills up. But if someone sits down and takes you through a football practice, takes you through how to pass, how to shoot, how to kick, how to head, how to tackle, then you're going to get the skills. You can repeat them, you can hone them till they're really controlled and really going well, and then you'll be a far better footballer. So what I'm about to show you here, there's no magic bullet, there's no magic glasses, no pill, no coloured glasses, nothing like that. But don't give up. There is a way, but it takes commitment and time. But one thing's for sure, and I want to emphasize this, guys. The answer is not doing more of what they hate, hoping that one day magically they will improve. It's simply not that. That's what remedial reading is. I joke with many of my remedial reading teachers who are friends of mine, doing the same thing over and over again, hoping that one of these days something will happen. And it doesn't, because you're just repeating the same mistakes. Surely it's time to pull our kids out of that and train the skills they actually need. So, here's 3 steps to conquering visual dyslexia and learning problems. Nice, easy ones. Number 1, get an eye test. Number 2, do some home vision skill testing yourself. So, make sure that you can see that your child is struggling in these. Make sure that it makes sense to you, in essence. And of course, step 3, do something positive and proactive about it and find the right therapy program, which I believe I have for you here today. So step number 1, get an eye test. Many of you have done this already, but you can ask your teacher about your child's learning, and then come and see us and get a professional, competent eye test. Now, why am I different at ICU? What do I do that's different? Well, apart from the obvious. Let me give you a bit of a rundown. Most optometrists will test sight and eye health, and they will tell you if your child is long-sighted, short-sighted, or has astigmatism. That is it, folks. For most optometrists who look at children, your average optometrist, your guy down at the big chain stores or whatever, that's what they tell you. Are they long-sighted? Are they short-sighted? And can they see 20/20 or 6/6 vision? But I'd urge you not to stop there, because it's simply not the full story. I also look at focus. I look at eye teaming, the way they team their eyes together at distance and near. I look at perceptual tests, how they use their eyes, their eye movements, visualization, hand-eye coordination, directionality, left-right awareness, eye dominance, a whole bunch of stuff that goes way beyond what regular eye testing is about. So how many of you have had an eye test for your child and been told there's nothing wrong? Many of you have before you come here. But you go away thinking, well, how can there be nothing wrong? My child gets sore, tired eyes when they try and work. They have no concentration span. They get really cranky when I ask them to do homework and try and get them to do. You know there's something wrong, but the optometrist can't figure it out, essentially. Here's a couple of very quick home visual skills tests that you can do. Number one, use our symptom list. So we can email this to you if you want, but we have a symptom list that you can download. And just very briefly, I'm going to show you a simple focus test, a convergence test, an eye movements test, and a memory test, just to give you an idea. But most important bit is the symptom list. So here's the sorts of things we're looking for in a child. And if your child shows some of these, you are a prime candidate for learning at Lightspeed. We're looking for the following: red, sore or itchy eyes, jerky eye movements, maybe one eye turning in or out, and certainly not flowing and following, squinting, eye rubbing, excessive blinking. These are all eye strain, obviously. Blurred or double vision, headaches, dizziness or nausea after reading, and that's more common than you'd think. A lot of kids suffer when they push themselves to read. Head tilting, closing or blocking of one eye when reading, and in particular, this is the big one, poor concentration for near work like reading. Poor concentration, the number one symptom we see. Kids can't concentrate. Here's a hint. If they can concentrate on a movie, which runs for over an hour, but they can't concentrate on their book, then it's going to be an eye problem. Are you sure? I'm absolutely certain. It's not ADD or ADHD because you can't switch that off when they watch a movie and switch it on when they read. If they can concentrate on a television show or a movie, which is a distance activity, but can't concentrate on their homework, it's almost always an eye problem. So here's some more. Does your child show the following performance cues? Avoiding near work. Ka-ching! Poor concentration again. Frequent loss of place when reading, omitting, inserting or rereading letters and words. And that's very frustrating for the kids too when they do that, to have to reread it again and again. Confusing similar looking words. Failure to recognize the same word in the very next sentence or on the next page. Does your child show any of the following? Are they smart in everything but school? If your child is smart at everything but school, you've got a smart child with a learning problem, and we can help. Better verbally than when reading or writing. Now that's a key one, because reading and writing are very visually intensive, and verbally is their brain, straight through to their brain. Do they have low self-esteem, poor self-image, or a sensitivity to failure? Do you see temper flare-ups, aggressiveness, frequent frustrations when doing homework, frequent crying, especially during homework? If homework's a drama, essentially, that's what we're looking for. And once again, the same one: poor concentration or short attention span, irritability, and daydreaming. Some kids are so nice, they don't get irritable, they don't lose concentration and walk away and disrupt the class. They just float off with the pixies. So, they're supposed to be doing work, and you might even think they're thinking deep thoughts or pondering a question. But what they're doing is they're floating away. They're daydreaming. Here's some more. Is your child frequently labelled lazy? Or, they don't try. Oh, this child's lazy. I even have parents come to me and say, my child's lazy. And here's the thing. Most kids, some kids, of course, will be lazy. Most kids are not. Most kids want to please mum and dad. And so laziness doesn't do it. They're not lazy intentionally. They're just having terrible trouble trying to concentrate. Do they get the label dyslexic, attention deficit disorder, or ADHD sometimes? Maybe a slow learner, behavioural problems, a juvenile delinquent? We'd hope that, your child has not reached that point. Do you get told that they're working below potential? That's a really interesting one. Or could do better if concentrated more, could do better if applied himself more. So let's run through a couple of these tests. Now, these are just for your interest. I'm not going to dwell on these because we've done most of the testing in the office anyway. This is the focusing test. Hold a book close. You have a printed card on the wall and get them to go from one to the other, saying yes each time it's clear. Do it 20 times. And if it takes longer than 40 seconds, or if you hear them slowing down, chances are you have a focusing problem. Eye teaming is this one where the little guy's looking at the pen here. You move the pen closer to the eyes and watch the two eyes. If one drifts away, note the distance at which it happens. If it's any further than 7 centimetres from the nose, you may have an eye teaming problem. What about an eye movement test? You hold the pencil. You might have seen me do this in the office, and you move it from side to side and ask them to follow the pencil, but many of them, they lose it, they can't follow it, their eyes are jerking and wiggling and wobbling and all that sort of stuff. Or a visual memory test, and this is just a quick little test we devise. You write some numbers down, 2 series of numbers, not 1 through 9, so 1 through 9 twice, right? You hold a book to block the child's view and place 2 numbers behind the book, but not side by side. So at random places. Remove the book for a second, then replace it. Ask the child what the numbers were. Then you can add more numbers. And the whole idea is to measure, because it's heavily dependent on age, but the whole idea is to measure and to see if they are able to remember the numbers. Now, not the sounding out of the numbers. We don't want them in a line so they can just read them and remember the sounds. We want them to try and remember it by visualizing it. And of course, the third part of our 3-step plan, is to do something about it. It is not good enough to test if we fail to treat. And honestly, I'll be honest with you, I see this all the time in my office. My child's been diagnosed with this, that, or the other, X, Y, Z, dyslexia, ADHD. They've been diagnosed with sensory disorder. They've been diagnosed, whatever it is, right? And my next question very often is, okay, well, what did they give you to do about it? Oh, nothing. Hey, wait a minute. So you went and paid hundreds of dollars for someone to give you a diagnosis that they can't give you a cure for. They can't give you anything to do. They can't give you a shot at getting rid of it. They just give you a label you can stick on your child. It's not good enough. It's not good enough to test if we fail to treat. You've got to be able to treat it. What's the point of diagnosing something if you can't make it better? Anyway, that's my thoughts. I'll hop off my high horse now. Testing and diagnosing is pointless if you don't do something about it. And here's the other thing, parents. Doing something is always better than doing nothing. I would always, if I got 2 diagnoses and somebody said, well, here's one diagnosis, here's the other one. And one person said, well, there's nothing we can do. And the other person said, here's at least something you can do. I'd always choose the second one. Why? Because it's better to do something than nothing. It's not good enough to just do nothing. Because if you do nothing, nothing will change. So, you may have had various diagnoses when you came to see me, but always accept the do something advice over the nothing can be done diagnosis. It's really important. But if you take the wrong advice, you'll find yourself wasting time and wasting money on therapies that look magic but simply don't work. Now, not all advice or therapies work. It's a fact. What sort of therapy is going to work? What is in a perfect world, what is the perfect therapy? Well, let me give you some thoughts, my thoughts, how I tried to design it. I wanted to design the perfect therapy. It's easy to join, it's easy to do, and it has simple instructions. So you haven't got to be a rocket scientist to try and figure out how to help your child. You also don't have to be a trained professional. It's done in your home with no travel. The amount of time you spend going into somebody else's office to get treatment is phenomenal. And we'll come to that in a moment. The ideal therapy takes around 20 minutes per school day. If it's taken 3 hours a day, you can't keep it up. You simply can't do it. It's quick and it's succinct. It lasts no longer than 9 months for guaranteed results. So I've met people who've been doing therapy, particularly say speech therapy, for 7 years. Wow, I'd have given up 6.5 years ago. If I can't get a result in 9 months, then something's not right, in my opinion. Most importantly, the ideal therapy is fun. Kids have to enjoy the activities and games, not endure them. If it's fun, they'll want to do them. If it's fun, they'll say, hey, come on, Mum, it's time to do the therapy. If it's really hard work, they'll avoid it like the plague, and it will be a battle. So, vision therapy is like any other therapy. A little every day is far more powerful than an hour or 2 a week. And you need to see it through. You can't start things and expect everything to be better by tomorrow. It's going to take time, and you've got to stay the course and see it through. But a little every day is far more powerful. That's why I do home-based therapy. I know I've got better gear, I can get better things in and probably do a better job, but I can't get you in my office every single day. And it's more powerful to do a little bit at home each day than to come into the office once a week. And again, I say not all therapies are the same. So training visual skills is incredibly powerful. If you train the core visual skills, you literally, now take note of this, folks, you literally cannot fail to see improvement in your child because you're training what we all use when we read and learn. So people say, does your therapy work? The short answer is yes. 100% of the time it works because you literally can't miss. If you go to football practice, you'll be a better football player. If you go to guitar practice, you'll be a better guitarist. If you go to tennis coaching, you'll be a better tennis player. You can't go to guitar practice and be worse unless you've got a pretty incompetent teacher. So if you do vision therapy, will your visual skills improve and hence your reading and learning? Yes. How far they go depends on how well you do the therapy, but if you do it, you'll definitely see improvement. And I know because I've done this particular therapy program or parts of it with dyslexics, Asperger's kids, ADHD, autistic kids, and we scaled it right back to some strongly autistic kids and still got some positive results. Adult illiterates and even refugees. In fact, we trialled it up in Malaysia at the school in Malaysia. They have 900 refugee kids that they teach every single day. And with the ones who were struggling, we trialled our program and it worked fantastic. These are bright kids who never had the chance to learn and never had the chance to read and understand, and they're stalled right on the starting blocks. You get a child in who's age 10, you say, sit down and start to learn, and they go, nothing there. Because they're you can't expect them to read like another 10-year-old. You've got to track them right back and build their visual skills properly. My vision therapy works on this principle. If you give a child a fish, you feed them for a day. If you teach them to fish, you feed them for a lifetime. You might have heard that proverb, but what it means is that if you give the child the skills they need to learn, they will learn, and that's what a good vision therapy program actually does. It gives them the skills they need, and once they've got those skills, they can do all the learning they want themselves. We empower them to become great learners. It's also built on this principle. If you do something often enough and you train the skill until it becomes automatic. So I've got this gentleman here beside this jet fighter. You would like to think that when he's up in this sort of situation that he is highly, highly trained. And I was actually, I'm listening to some audio presentations from a guy who was a very skilled Navy pilot over Afghanistan and these sorts of places. He talks a lot about training. See, this is how training works. You do something, initially it's hard. You do it again and again and again and again until it becomes second nature, totally automatic. Then when you're under pressure, the training comes out. So if you're doing vision therapy or vision training, you want to train the skills a child is using so that when they're under pressure to read, automatically, bam, those skills come out and they're able to do the job. Here's another testimony from one of our patients, and it shows you that we're getting real results, and this is just one of many. Here's another one. 12 reading levels in 6 weeks. We like it. We'll take that any day of the week. So let me recap on how you can conquer visual dyslexia and learning problems. Number 1, get a proper eye test, preferably from us. Number 2, do some home vision skills tests and make sure that you know what you're doing and you can see problems in your child. And number 3, do something positive and proactive about it. And here's what I believe is the best thing you can do for your child and their future learning. Come and join us at Learning at Lightspeed. Our exclusive program trains the actual skills that kids need to learn. We train the visual skills they actually need, not something theoretical. Skills that we know that people use when they're learning. It works through a developmental progression. This is really important. It starts with the very basic skills and progresses right through to advanced skills. Now, I mean, one of the frustrations I had with other vision therapy programs was they seem to jump all over the place. That's not the way to do it, folks. If you're going to build a wall out of bricks, you've got to lay them brick upon brick. You can't leave gaps everywhere and then come back and try and jam a brick in there later on. You've got to do it step by step, layer upon layer, and then it will work well. Also, learning at Lightspeed involves games and therapies which are fun, highly targeted, and takes only 20 minutes a day, school days only, and it can catch a child up. So the glasses get them to concentrate more, but the vision therapy will catch them up and in many cases give them an unfair advantage over their peers. So, for example, if we've got a child who's in grade 3 and the vision therapy will train skills that she won't use until she's in grade 5, but she's in grade 3 and you've given her skills that are 2 years advanced, do you think that will be a burden for her and her learning? Not at all. The other kids haven't got these advanced skills that she will have developed. So that's why we can train kids not just up to average, but right through that to the top of the class and give them an unfair advantage over their peers. It's designed by a passionate professional who has experienced the anguish you are feeling right now. And this is so true. As I said before, I've sat where you've sat. I've struggled with your struggles, dealt with the frustrations, and I'm passionate. I love what I'm doing, and I love seeing great results. It's designed to target the visual skills your child needs, not just my optometry measurements. And it's simple, it's fun, because that's how you get kids to do it. Keep it simple and fun. That's my mantra. And above all, it works. Proven results, guaranteed, and I'm sure you're going to love it. So, what's the game plan? I'm sure you're sitting here saying, dude, what's the game plan? Well, we need to get the right techniques in the right order and leave no stone unturned. You don't want to get through and say, gosh, I thought he had that skill, but now that skill's missing and now he can't do this next skill because he's missing one of the previous steps. So what we do is we track right back to prep or even pre-prep and make sure we miss nothing. That doesn't mean your child's got to go back to prep, of course, but we're going to track them right back, as far as learning visual skills go, right back to teach them from the ground up. Which means if your child's in grade 5, chances are the first month's going to be dead set easy. Fantastic. That's brilliant. They'll find it easy. They'll say, oh, this is a piece of cake. I love it. But of course, if your child's in grade 1, it's going to be a challenge right from the get-go, most likely. The second thing is we build the right visual skills layer upon layer, doing the right techniques in the proper order. It's no good jumping all over the place and throwing bits of paper left, right and centre with all these different techniques on it. You've got to do the right ones in the right order and build upon what's already been laid, like that brick wall we were talking about. And thirdly, they gain the skill and the confidence to use it. As kids go through, like you say, why are you getting grade 5 kids to do these very basic things? Well, a couple of reasons. One, so that no stone is left unturned and we make sure they've got the skill. Two, because if they're good at it, suddenly they're full of confidence. These kids are not used to being good at things academically. They're used to doing badly at things. So if you give them a few runs on the board and make them feel good about themselves, that is not a burden to carry. And you know what? To track right back to prep and rebuild from there maybe takes you a month, maybe 2 months longer. That's nothing in the scope of things. A month or two for the rest of your life for doing it right. The idea is not to rush through and be the first finish. The idea is to do the job properly. So, what are these skills that I'm talking about? Well, here they are, the 7 key visual skills that your child needs to learn effectively. We train focus, eye teaming, eye movements. We train visualization, laterality, hand-eye coordination, and then a whole bunch of other perceptual areas like coding, sequencing, etc. So let me run through these and what they do. Focusing. If you have a child who's struggling to focus, yes, the glasses will help, but if they're struggling to focus, then they will struggle concentrating on reading. So if you train it, you'll get an increase in concentration for reading. It also helps them copying off the board. 2 aspects to focus: holding it for a sustained period of time, that's the concentration bit, and copying off the board is changing it from distance to near and back again, what we call facility of accommodation or changeability, and that helps them copy off the board. If you train focusing, you relieve tired, sore eyes and headaches, and it also improves comprehension and retention. Does all those things. Eye teaming is quite similar. If you train it, you get increases in concentration and improved reading flow, so they don't misread words and that sort of stuff. You get decreases in things like double vision and general eye stress when reading. The third thing we train is eye movements. Now, eye movements, once again, will give improved reading flow, and you'll get a decrease in misreads, skipping of words, skipping of lines, all that sort of stuff. It will also help them as they copy off the board. It will help them find their place. We can train this so that they can be effective at it. And here's a bonus: if you train eye movements, improve ball sports, especially tennis, cricket, baseball, and soccer. So If you ever saw the old film of Sir Donald Bradman when he went back to Bowral, his hometown, and he showed people how he spent his time as a child. He hit a golf ball against the side of a water tank with a cricket stump. And so when he got out to hit a cricket ball with a cricket bat, it looked enormous to him because he'd done vision therapy, he'd done eye movement therapy, and that's why he was such a good batsman. So we can improve all those things. Fourthly, visualization, my favourite area. I love this stuff. This is for improving spelling. Let me ask you, if we pause just right now, mums and dads listening to this, let me ask you a question. If I were to come to you and say, spell hippiastrum, just take a few moments, spell hippiastrum for me. Can you do it? Now, I'm not interested in you doing it, but I guarantee almost all of you looked up and away and tried to visualize it. So that's the skill you use to try and recall that word. You visualize it. Now, what if your child can't do that? What if your child can't utilize the very skill that you just drew on to try and spell a word? You've got a child who is handicapped when it comes to learning spelling words because they are completely lacking the skill. So we train that skill. It improves spelling. It improves memory. They get greater creativity. I love visualizing. It's awesome. The next area is laterality, which is essentially left, right, and processing. This, if we train laterality, we can stop them reversing numbers or letters. We can also improve their reading flow and direction. Hand-eye coordination, of course, improves writing and ball sports, especially catching and batting. Then the other perceptual areas, we're talking about coding, sequencing, a whole bunch of different things. There's gross motor, fine motor, a whole bunch of areas that we cover in our 7 areas, the key visual skills that your child needs to learn. So, in Learning at Lightspeed, here's what you get. Number 1, very clear instructions. We lay out what each exercise is trying to achieve and exactly how you do the exercise or game. You're not left to try and fend for yourself. You can always pick up the phone or shoot me an email, and we can explain it to you if you need it. But the instructions are pretty clear. You also get charts and handouts that you need. You can run off copies as you need them. You get record sheets so you can plot your progress in each activity, and you get email support. We're here when you need us to try and help you. I would also say we've included some computer game versions of some of the games as well, which the kids are loving. So there you go. And each game or technique is designed to build on the previous one. So it follows a very set, regimented path, and it makes a lot of sense. So people say, well, what's it look like? Give me some example. Here's an example. This is one of the exercises we do. It's called Capture the Mosquitoes. And what you've got to do is circle each one 3 times without stopping. And you obviously, while you're circling, you've got to scan ahead to try and find the next numbered one in order. And we've got this as a computer game as well. This is a typical example of the sort of exercise you get. So you would say the exercise is called Chart to Book Focus Rock. There's the purpose, what you will need, and we give you those charts, the method, and then the variations, things you can do to weight it or make it more difficult or challenge the child more. So it's pretty self-explanatory, very easy to follow. So that will be an example of the chart. That's actually not what it looks like. It looks a lot better than that. That's just one that I copied in here. Here's another example, visual memory activities. So there's the objective and then the activities. There's 5 or 6 in this particular activity, but here's just 3 of them. So selection of objects, remove an object, actually, that's just A. There's about, I think, 4 or 5 in visual memory activities that you'll need to go through. So, if you are struggling right now with a child who has dyslexia, learning difficulties, Asperger's, ADHD, or is just plain underperforming, this could be the best news you've ever heard. And hopefully right now, you're getting very excited about this, saying, my gosh, there is a way ahead. There is something I can do. There is something that can be done to help my child. And believe me, if you do it now, even if you put time, money, whatever into it now, it will be a fraction of what you'll have to deal with if you let your child go for years to come. Once they get into high school, it is much more difficult. So my recommendation would be act fast, do it now, and minimize the pain for the future. Here's the thing. You've learned a lot of information in this webinar. But if you don't commit to anything, you can rest assured you have a 100% chance of changing absolutely nothing. You might say, oh, that's a nice webinar. Yeah, thanks, Darin. Thanks for all the info. Nothing's going to change. I'd urge you, I beg you, commit yourself to doing something. This is something positive you can do that will change your child's life and their future. If you love your child, please consider doing this stuff because it's better than doing nothing. And if you've never done therapy before, you might be thinking, oh gosh, this seems overwhelming. How am I going to deal with it? Well, look, we're here for you. It's simple. It's easy to follow. It's games, so your child will generally love doing it. And we target all the areas that we need or that they need to learn effectively. But what does it cost? I hear you say, oh my gosh, it's all going to cost money. Yes, it is. Not a lot, though. Learning at Lightspeed targets these areas. Now, if we trained each of these areas separately, we could charge $297 per module. So for focus, eye teaming, eye movements, visualization, laterality, hand-eye, and all the other perceptual areas, that would come to $2,079. A lot of money. Plus, we'd throw in all of our full support, our instructions, charts, video demonstrations, talking you through, email support, record sheets, everything you need to transform your home into a vision therapy centre. With you as the therapist, that's valued at $500. So when you put it all together, it is worth $2,579. Now, I'm not going to charge you that, but that's what we feel that it's worth. And before I reveal to you our special price for you guys, let's have some fun. I want to add 4 incredible bonuses. These are parenting books. I'm just going to buzz through these quickly. They can have a huge impact on your life, your family, and your children. If you want to get better as a parent, study it. Train in it. Here's the first one, the Involvement Informal, which basically deals at getting parents actively involved in their child's schooling and helping them to make the right decisions. It's worth $27, yours free when you join Learning at Lightspeed. Here's another one, How to Raise Great Kids. 75 Q&As about raising great kids, dealing with bullying, lying, all this sort of stuff. Self-esteem, even a picky eater. I had one kid that would have been very handy with. Encouraging your child to read, a whole bunch of stuff. 75 questions and answers, it's yours free, normally valued at $47. Raising children who succeed, and who doesn't want their child to succeed? So we're going to look at what success is, what children do and don't need, books, role models, social skills, handling money, whole bunch of stuff that will make your child a better person and a successful person. And the Smart Parenting Guide. So a great way to raise kids, encouragement, how to not be demanding, ouch, forms, values, behaviours, touch and hugging, a whole bunch of things that parents need, valued at $37. So I'm throwing those 4 bonuses in. So you get, again, the 7 modules worth $2,079, full support and email access worth $500, and those modules and the whole lot is worth $2,727, but... and here's the but, I'm not going to charge you that. You won't pay that much today, I can assure you. But before I tell you my special price, I want to ask you an important question. When you're thinking about committing to doing something, you need to ask yourself this: can you do all this another way? So can you get vision therapy somewhere else? And if so, how much does it cost? By the way, the vision therapy somewhere else would not be my program because I've designed this one for my patients. What does it normally cost? Well, if you get on the internet and have a look at it, for example, most vision therapy that I've sourced costs around $139 a session for in-office therapy. Most optometrists recommend twice weekly sessions for 8 weeks, with the second block often a month or 2 later. So we're talking about a minimum of $2,224 in 16 weeks. Plus, and here's the hidden cost of this sort of stuff, you have to travel to and from their office. That's time, fuel, snacks along the way, which for 16 sessions, if we allowed $30 for fuel and the kids saying, can we go to McDonald's afterwards? So $30 is probably pretty cheap. It comes to $480. So the total for 16 sessions of vision therapy is $2,704. And if you need the second block, which we talked about, it's $5,408. So that is a lot of money We can do a lot better than that, I can assure you. For 8 weeks, 2,704, or up to 5,408 for 16 weeks. And I'm guessing a lot of you don't want to pay that sort of money. I don't want to pay that sort of money either. I'm guessing you also don't want to invest all the time and effort to take your child to their rooms twice a week. That's even if you can find one in your area. But of course, in our area, there's one or two others. But the other thing too is that most of these therapies are designed to change optometry measurements, which is nice if you get an improvement in performance, and sometimes you do, but often it doesn't improve your performance. So it's a lot of money to pay for something that doesn't see your child learn better. That's what I reckon. So let me tell you this again. My exercises and therapies have not been designed to change measurements in my office. They've been designed to help your child learn better. Tangible, observable improvements. I'm not sitting around talking about ethereals here. I want to see genuine results. But what about other sorts of therapies? You know, there are medical professionals out there. There's other people who think they have the answer to things like dyslexia and learning problems. Let's have a look at some of those. So first of all, let me say this. Dyslexia is a huge and highly controversial area. There's everything from pills to coloured glasses that are claimed to help. I'm one of the claims. Which ones work and how much do they cost? It's a huge question. And beware of any miracle cures, because so many people go down this path. They say, oh, if I get these coloured glasses, or if I get this magic pill, or if I do these hand movements, or this type of therapy, or if I get their back crunched a certain way, whatever it is, hypnosis, that suddenly it'll all come good in one hit. There is no all come good in one hit. If your child is behind at school, you've got to do some work. There is no miracle cure here. But there are a few alternatives, and I won't even, in this discussion, I won't even go into some of the most outrageous and controversial treatments, but I'm going to look at some of the methods that are pretty well established within the learning disabilities and remedial reading fraternities as being viable ways of helping your child. You could have your child assessed by a pediatrician, who is a doctor who's a specialist in children, who is likely to recommend medicating your child to help them to learn with drugs like Ritalin and dexamphetamine. Now, I cannot even begin to go into the number of side effects these things offer, from behavior changes right through to a whole bunch of other things. But the costs of consultations and medications will usually come to over $1,000 a year. So that gives you a ballpark figure there. Or you could have your child assessed by a clinical psychologist. You can identify the areas where your child is behind in their age norms, and they may offer a few suggestions as to how you can help them, like sit them at the front of the class and don't give them any more than 2 instructions at once. But there's no actual program to help. So you've paid $550 and you get a nice report, but nothing to do. Now, it is a helpful report, I'll admit, and they are very good at what they do, but they don't have the answer on how to change it. They can diagnose it, but they can't change it. Or you may hire a tutor who can only do what you or a teacher can do, perhaps with more skill and a bit more knowledge, but they're still fighting the same thing you are, lack of skills. In fact, one of the big tutors in our area has come to me, and we've had talks with them because they've noticed the kids who are doing vision therapy are improving dramatically versus kids who are not. And that really is the way it's working. But a tutor will cost you up to $90 a week, which is $4,680 a year. And they battle the same things you do. Lack of visual skills in your child. So they're trying to solve the problem, and oftentimes they can get some improvement. But if you've got a child who's being tutored and the improvement is limited, then you need to check out vision therapy, because it's going to be the key that opens the door to making the tutoring really work effectively. But the fact is, folks, there is no comparison. Doing something is better than doing nothing. And vision therapy, while it is not a quick fix, it's not a magic bullet. It takes time and effort, but there is nothing else that can train the actual skills your child needs to do the job. Now remember, I said there was $2,720 worth of value, because you won't pay that. We have a very special price today just for you, because I know what it's like. I've sat where you've sat, and I've gone through all these things that you're going through. because I'm passionate about seeing kids succeed in school, because I understand how frustrating it is to try and help your kids when things are going wrong. And also, I know most of you who are listening to this webinar, you want to do something, anything, to help your child and to save them from a miserable academic future. I understand that, and that's why. $2,727 worth of value, but today it's only going to be $127 a month, and that's over 9 months. $127 a month. That's $32 a week, and we can do a weekly thing if you want. But just for fun, let's make this really cool. We'll give you some extra bonuses. I'll buzz through these quickly. These are great ebooks. Teaching kids good decision making. Who doesn't want your child to make good decisions? Trust me, if you have a teenage girl, you'll be praying that they make good decisions. So that's one of the books we're looking at. Asperger's Answered reveals. Now, many of you are struggling as we did, as my wife and I did, with an Asperger's child. You love them, but this book will give you some answers, some understanding. Maybe your child hasn't been diagnosed, but you suspect that they could be Asperger's. Well, this will give you the answers and an understanding that you just can't get anywhere else. It's a great book that's yours free. The Child Diet Dilemma. Ouch. Childhood obesity is a huge problem, and I'm going to throw this book in anyway just because I thought it was cool, and I think it's something we should all be thinking about with our kids. Garbage in, garbage out. We've got to feed them the right things. And finally, for those of you who are single parents, here's an extra bonus for you. It's a great book on single parenting as well. So let me run through this just finally as we wrap it up. You've got the 7 modules worth $2,079, full support and email access, plus you've got all of the 8 bonuses. The total value is $2,875, but of course, you only have to pay $127 a month for 9 months. You get all the bonuses. That's $32 a week. And if you have a cappuccino a day, that'll add up pretty quick. Cut your cappuccino out. Invest your time and money into your child. It's really important. The earlier you start, the better. If you start when they're young, you will head off problems before they become major problems. The younger you start, there are many parents listening to this webinar whose children may be in grades 5 or 6 who are wishing they could swap places with those who are listening to this webinar whose kids are in grade 1 or 2. It's not lost if you're in grade 5 or 6. You've just got to work that bit harder. It's a lot easier if you start early. So I'd encourage you, do something. It's better than doing nothing. Please do something to help your child. Give them a fish, feed them for a day, teach them to fish, give them the skills, and you will feed them for a lifetime. So Learning at Lightspeed has been designed by myself to give your children the skills they need to succeed in learning for the whole of their life. Once they haven't got to go back and top this stuff up. Once they learn it, they've learnt it, they'll use it for the rest of their life. It's only $127 a month. It's $32 a week to change your child's life forever. You can conquer dyslexia and learning disabilities and give your child the chance to become all they can possibly be in learning and in life. Hope you've enjoyed this presentation. It's been an honor to bring it to you. You'll see a button directly below. If you want to go ahead with it, and I urge you to do it, at least give it a go. Please give it a go, because it's better than doing nothing. There's a button underneath. Click on the button. It's a PayPal thing. It won't take out too many. It just runs its course and stops. But you can be part of this starting in 10 minutes time. In 10 minutes, you can click on the button, do the PayPal thing, and be right there enrolled, downloading the first lot and starting to do these therapies with your child. If you have more than one child, download the therapies once. Do it with, if you've got 10 kids, do it with all 10 of them. What have you got to lose? You can't hurt. It cannot hurt. It can only help, and it can help profoundly if your child is struggling with the lack of visual skills, as we've seen in this presentation. So, all the best with that. If you have any questions, email me or call me, let me know, call the office. We're always here for you, and we are hoping to accelerate your child's learning to light speed. We want to see them prosper and do really, really well. And their future is in your hands right now. What are you going to decide? The decision is with you. What are you going to decide for your child? $32 a week. It's not too big. Do it now. Have a go. And let's accelerate your child's learning to light speed. God bless you. We'll catch you later. Cheers.